What's up, doctors? Let's talk about how to get back to practicing medicine in just 2 hours of setup instead of managing leads and phone calls. In fact, the setup is even jumping on 2 calls with us because we'll help you do it. Finally, this is the first AI system designed specifically for healthcare that sounds human enough to even fuel your best staff. Listen, if you're a practice owner drowning in patient calls, texts, emails while watching potential patients slip through the cracks, this might just be the most important message you'll see this entire year. Because here's what's happening in your practice right now. Every minute that you're not responding to a lead, they're calling your competitor. Every missed call is money walking out the door. Every scheduling conflict creates patient frustration. And meanwhile, you're stuck managing communications, managing the staff who are managing those communications instead of doing what you're trained for and really probably want to do, providing exceptional patient care. Listen, I know, you didn't go to school to become a front desk call center manager, but that's exactly what's happening a lot of times, isn't it? Or just that it should be happening and is slipping through the cracks and just not getting done because you're a busy practice owner, busy doctor. What if I told you there's a way to handle every single patient communication, calls, texts, emails, and live website chat without adding a single staff member? In fact, some offices are even doing it while slimming down their staff because they no longer need them to handle this. What if this system could respond to leads in seconds, 10 seconds, schedule appointments automatically, and even bring back old patients and old leads doing recalls and reactivations, all while you and your team focus on patient care? I'm excited to announce and introduce you to the AI Patient Coordinator. Like I said, this is the first AI system designed specifically for healthcare practices that handle your communication like a team of dedicated patient coordinators working 24/7 around the clock, no lunch breaks, no bathroom breaks, no sick days, no vacation leave, no pregnancy, or ever asking for a raise. And don't just take my word for it. I'm going to show you exactly how it works. But first, listen to what Dr. James discovered when he tested our system. We listened to the call and it was so crazy. He even sounds like he got a slight sinus infection. It's wild how real it sounds. Dr. Charlie thinks Terminator is going to come true and robots will take over everything. But she even said on the call, and pardon my language, but she's like, it asked everything that we want our people to ask. It wasn't like calling UPS and trying to get a human. I got to admit, it was pretty darn good. If it didn't say AI Casey, I don't think I would have ever known. And here's what Brennan Mallory said after going through our system. So I went on, this practice's name, Facebook ad, and went through all the steps. The AI is amazing. Is our backend going to be set up the same? The AI doctor voice will be the same, except for obviously it'll say this name, and not the doctor from blank. Also, the follow-up emails and texts will have the same setup correct. He was so stoked. And that's right. Brendan was so stoked. He immediately wanted to know how to get the exact same system as our demo for his practice. So here's what it does. Number one, immediate response. New leads from your website and ads get followed up within seconds. Outbound calling, as along with outbound emailing and texting, and responding to all of those. Complete communication coverage handles all your patient communications. Inbound calls, we could change the phone number on your website or have your office line direct to it for after hours, which some offices do, or all hours. Additionally, on all of your ads, TV, radio, digital, social media channels, the phone can be directed to this. In addition, we will have text and email lines set up. If you use Go High Level, we'll integrate directly with that. Otherwise, we'll build you out a system where everything will be integrated and it will be responding to emails and texts from your website, funnels, and ads. Patient re-engagement. We go ahead and take your databases and we go ahead and run campaigns to them, bringing back old patients and leads. If you're doing recalls, we're going to light it on fire. We're going to pour gasoline on it and do way more than you ever seen possible. We could be ripping hundreds of calls a day along with emails and texts. If you're not, it is a huge moneymaker that you're missing out on. It'll drive a lot of patients for you. Old leads and old patients. Personalized outbound texts and emails and calls. Now, full appointment management. So any new lead, now when it's on the website, it'll like we set up the call flows and everything the same as you do. Are you a new or existing patient? What are you calling about? And then kind of go and route it. For new leads, it'll qualify the leads on quality of life, pain, severity, motivation, and financials. Totally optional, but we'll set it up to your practice. Can collect deposits. Some of our offices, we have it actually collect a prepaid deposit for the initial consultation. Schedule appointments. Ensure the patient knows the next steps before the appointment. Walking them through, we can send them intake paperwork and make sure they open it up from their email and text and have it. We could direct them to bring their spouse We could also make it mandatory and tell them it's mandatory, et cetera, et cetera. Calls, texts, and emails. Additionally, once they're booked, we'll be following up to confirm the appointment. If they can't make it, we'll reschedule or cancel it. Additionally, if they cancel or no show, we'll also follow up with those folks once you guys just update the system. So pretty freaking cool. It does a lot. And it's like having a team of your best patient coordinators working around the clock, never taking a sick day, and never missing a call. Here's the thing. While you're thinking about this, your competitors are already implementing AI solutions. Not to mention also that we'll implement this stuff on your website, new forms, new pop-ups, integrated with the forms, live chat add-on, which will help your website conversions. And missed calls, forgetting about leads, and slow follow-up times are costing you patience. Every day you wait is another missed opportunity, overwhelmed staff, and lost revenue. Let me show you exactly what I mean. I'm going to call one of our AI patient coordinators right now live. You could listen to how it handles a real patient. Check this out.
Thanks for calling Health Solutions of the Palm Beaches. This is AI Casey. What can I do for you?
Hey, AI Casey, I saw your ad on Facebook.
Great to hear you found us through Facebook. Before we dive into the details, I need to confirm that the best number to reach you is the one you're calling from, which is 5. Give me just a moment while I get more details.
Cool, no problem.
Thanks for your patience, Zach. I see you're interested in our services for disc pain. Let's start by understanding your specific needs. 1, we can treat disc pain, but which specific areas are affecting you? 2, what does it feel like? 3, how long have you been experiencing these symptoms? Feel free to share as much as you're comfortable with.
Yeah, I've been dealing with it for 4-ish years. Just like it's painful throughout the day.
I'm sorry to hear that. It's been a long and painful journey for you. It sounds like it's been quite challenging. If you don't mind, I'd like to ask a few more questions to better understand your situation. How has this disc pain impacted your daily life?
Honestly, I can't do the things I used to. Working out is tough, and just
Must be really
sleeping.
frustrating. I'm sorry to hear that. It's affecting your sleep too. Has it always been this way or has it gotten worse recently?
It's definitely gotten worse recently.
I'm sorry to hear that. It's been getting worse. Why is it important for you to get this resolved now?
I think it's gotten so bad, I just can't bear it. I barely sleep at night.
I'm really sorry to hear that, Zach. It sounds incredibly tough. On the worst days, how would you rate your pain from 1 to 10? 10 being excruciating and 1 being painless.
Yeah, 10.
I'm really sorry to hear that it's reached that level. Have you tried anything in the past to treat this condition, like physical therapy, medications, epidural steroids, or surgeries?
I've done all of them. I'm taking a lot of medications right now. I take so much ibuprofen. It's kind of crazy.
It sounds like you've been through a lot trying to manage this pain. How well have those treatments worked for you?
They, obviously they're not. The dosage just keeps going up.
I'm sorry to hear that. It must be frustrating to not find relief. Have you had any imaging like x-rays, MRIs, or CT scans?
Yeah, I have some MRIs I got.
Great. Please bring those MRIs with you to your appointment. Based on what you've shared, it sounds like we can help. Would you like me to give you a little context on what's
That'd be fantastic.
based on what you've shared about your disc pain? I can see why this has been so frustrating for you. Most patients we see have already tried physical therapy, medications, epidural steroids, or surgeries without getting the lasting relief they're looking for. That's because those approaches often don't address the root cause. What makes Dr. Wayne Siegel's approach different is that we focus on identifying and treating the underlying cause rather than just managing symptoms. When you come in for your disc pain relief assessment, Dr. Siegel will provide you with a comprehensive diagnostic evaluation to identify exactly what's causing your symptoms. He'll review any previous treatments and explain your condition in simple terms. If appropriate, you'll be introduced to our laser enhanced spinal decompression therapy, which has helped many patients like you. Most importantly, you'll get a straightforward answer about whether we can help you or not. Does that make sense?
Cool. Yeah, that sounds good.
Great to hear that. Just imagine what it would feel like to be without the constant worry about your disc pain holding you back. That's exactly what we're working toward. This comprehensive assessment typically costs $249. But for the first 15 people who schedule this week, the investment is just $21. It's a significant reduction while we expand this part of our practice. The most important thing is finding out if we can actually help you. Do you have any questions about any of that?
No, that sounds good.
And of course, since we want to make sure each person is taken care of even after this initial consultation, if we can help with our protocol, Dr. Siegel will certainly be able to build a custom treatment plan for you to help you achieve long-term pain relief so that ultimately you can just be pain-free for good. without having to rely on things like medication or even resorting to invasive procedures like surgeries. Does that make sense?
Yep, that makes sense.
Great. Now, depending on how everything goes, if Dr. Siegel determines this to be what's best for you, the custom treatment plan will usually not be fully covered by insurance. So there will be some out of pocket, just to be clear. Typically, though, what we have seen is that it can start from as little as $81 per month to $417 per month with a qualifying credit score of 580 and above. If after the consultation we find that this can be a sustainable treatment option to help you relieve your symptoms for good, is that something that can work for you?
Cool. Yeah, that sounds excellent.
Fantastic. Now, let's make sure you're comfortable with the location. Our clinic is located at 3469 West Boynton Beach Boulevard, Boynton Beach, FL. It's west of Congress and a minus 95, right across from Aldi's on Boynton Beach Boulevard, just south of the mall. You'll see a little breakfast shop and our signs on our windows from the street. Are you okay with traveling to this location?
Yeah, that sounds good.
Great. Would you like to schedule your assessment now?
Yeah.
Let me check our availability to see what can work for you. We have 2 available slots this Thursday morning, 9 a.m. and 11 a.m. Which time works best for you?
What about after that?
Give me just a moment while I check what availability we have for you. We also have slots available this Thursday afternoon at 12 p.m., 1 p.m., 3 p.m., and 4 p.m. Do any of these times work for you?
Yeah, let's do the 4.
All right, let me go ahead and save that spot for you just a sec. You're all set for your appointment this Thursday at 4 p.m. Please check your email and text for the confirmation. If you don't see it, try checking your spam or junk folder. Before we wrap up, I want to mention that dealing with this pain isn't easy, especially based on what you've shared. If you'd like, you can bring a friend or family member with you to the appointment. It's always good to have someone you trust with you, especially for the initial consultation. Does anyone come to mind?
Maybe I'll bring my wife, but no, this should be fine.
Really fine. When you arrive, thank you for your time, and I've enjoyed the opportunity to help. If you have any questions or need further assistance, feel free to reach out. Have a great day.
Now, let me tell you what happened when we put this to the ultimate test. We used to run a 14-agent call center for our clients. Over 6 years, we hired and fired 125 reps, handling patient calls, scheduling appointments, and following up on leads. This is a screenshot of the 14 agents, and this is their setter, their attendance for the month. This is a screenshot right here of the last 6 years where you could actually see the total number of people we hired as we were ramping up, get to 56 people in 2024, and the total terminated and resigned. And you can see the churn rates. We terminated so many freaking people, and then would hover around this 15 or so percent resignation rate. It was a nightmare. Staff turnover was constant. People would quit. Now notice we would bring guys on and they wouldn't follow through or be good. We'd have to let them go. Train new people took weeks. Many of our overseas staff had heavy accents that patients struggled to understand. And the worst part is we had a script, we trained them on it, but they rarely followed. So this is an actual screenshot, if you could see this, of where we actually had 2 quality assurance reps full-time listening to every single call or as many as they can get through, and then grading them on if they did the things they needed to do. So for example, prepayment, 48% of the time this month, the team actually pitched it. Not was successful, actually pitched it. Now, when they did pitch it, they were 36% successful. Not bad, right? But 48% of the time, they pitched it. Screening severity, 93. Timing, 92. Spouse, 0% of the time. They were never asking for the freaking spouse to show up. And that was like a big thing clients would complain about. AI doesn't do this. It follows the script every single time. Here's another, just screenshot just of some proof where we were grading it. This was like a weekly or quarterly review. We had 2 quality assurance reps, like I mentioned. Many reps would achieve no more than 25 to 50% compliance for certain important parts of the script. You know what happens when your staff doesn't follow the script, right? Leads get lost, patients get frustrated, revenue walks out the door, and you get in front of patients that just are not qualified and are wasting your time, right? Which is ultimately holding you back from being able to serve more of the right patients. But the breaking point was if a lead texted our staff, right? If it texted back to a message, an email, right? It emailed back, and we responded back, right? But the lead never got back to us. The lead was lost. How would you track that? You'd have to go through a bunch of leads, right? Lost in the system, no easy way to track it. You couldn't really just set up an automation system. AI is the only possible solution. We were losing thousands of potential patients to simple communication breaks. So we made a decision that seemed crazy at the time. We invested over $500,000, entire year of building an AI system that could replace our entire call center. And the result, we shut down the entire thing. Every single patient call, text, and email is now handled by 4 AI agents that never take sick days, never forget to follow the script, and never lose leads. And here's what shocked us most. It's actually performing better, quite significantly better than our human staff ever did. It texts better, it calls better, there's no accent, it's insane. No more lost leads, no more missed calls, no more follow-ups, missed follow-ups, no more accent barriers, no more staff turnover, just consistent professional patient communication 24/7. What happened when a lead told you call them back at this exact time? It rarely would happen. If they didn't answer, what would happen? Right? We have all that built in. That's when we realized if this can replace a full call center, imagine what it can do for your practice. The limitations of all of this, though, we only bring on 10 offices per month because this is a thorough implementation, right? It requires attention to customize the AI to your specific practice. We set it up. We have the frameworks. We've done this literally now 83 practices where we've implemented these AI solutions, but it does require customizations to integrate it with the systems and make sure it's tailored and you guys are happy with it. If you're ready to transform your practice, though, and get back to focusing on patient care instead of managing communications, click the button below to schedule your personalized demo. We'll show you exactly how our AI patient coordinator will work in your practice with your patients using your brand voice. Now, I will say satisfaction is completely guaranteed. If we don't deliver or you're not happy for any reason in the first 14 days, not of setup, of us actually going live, just let us know and we'll refund every single penny for this thing. This isn't just another software demo. It's your roadmap to a practice that runs itself while you do what you love. Don't let another patient slip through the cracks. Click below and book your demo now. Remember, every moment you hesitate is a moment your patients are waiting. Your competitors aren't waiting. Your potential patients are. Take control of your practice's future. Click the button below.